Midwife Caroline here, an advocate of natural birthing ways. I am a private independent nurse midwife, and I offer a comprehensive midwife-led care to expectant mothers. I'm located in Laikipia County, Nyeri County, Meru County, and I can also go wherever the mother requires me to be. Now, I want to answer this question that I have been getting from mothers. What is a VBAC? VBAC is a vaginal delivery after cesarean section. Many mothers have been asking me, if you have had a previous cesarean section, can you give birth normally in the next pregnancy? Well, the answer is yes and no. It all depends why you went for cesarean section in the first place. And now this puts you in a tight position for you to decide if you want to have a normal birth in the next pregnancy. This depends with the reason why you went for a cesarean section in the other previous pregnancy. Now, number one, I'm gonna say one of the reasons if you can try a vaginal birth is the type of incision that was done. Now we have two types of incision. We have transverse incision, which is whereby you get the incision down here at the bikini line and it's transverse. And then we also have the midline incision, whereby the incision starts from the pubic area, it comes up to your belly button, like from the pubic area here, goes up to your belly button. So, if you got a transverse incision, then you're a good candidate for trying a VBAC. But for the midline, this one is not recommended you to try a VBAC because uterine rupture here, the risk is more high. It's very high for a uterine rupture than the transverse. So if you had the midline incision, so you're not a good candidate for trying a VBAC. Okay, number two, let's say probably your first pregnancy you had a vaginal birth. Pregnancy number two, you had a cesarean section. Maybe there was something, maybe there was an emergency, maybe there was fetal distress, or maybe you had some complications, or maybe you had very high blood pressure, and so you had to go for a cesarean section. So you tried that pregnancy, you'd like to have a vaginal birth. Yes, this one you can have, because if you had a previous cesarean section because of an emergency like a fetal distress, or the cervix didn't open, then there is no need for you to worry. The next pregnancy, you can have a vaginal birth. Number three, it also depends when you had that cesarean section done. If it is less than 18 months, I don't recommend to have a VBAC. But if it's more than 18 months, then you can try a vaginal delivery after VBAC. Also, number four, if you have had other surgeries, let's say you had fibroids that were removed in your uterus, and then you want to try for a vaginal delivery, this one is not recommended. So it's better you just go for a cesarean section after you have had your fibroids removed. Also, it also depends on how many C-sections you have had. Let's say, for example, you had like 2 previous cesarean sections, and now that pregnancy you want to try a vaginal birth. Well, let me say from experience, because I have seen it before, I saw somebody who gave birth vaginally after having undergone 2 cesarean sections. But the 2 cesarean sections, she was taken because of having high eclampsia in pregnancy. Hence, she had to go for cesarean section. But that pregnancy, she didn't have any high blood pressure in pregnancy, so she had a normal vaginal birth. Okay, this one also depends with doctors. There are some doctors who will not even risk you to go into labor, but there are some who will be open and they'll just ask you to try a vaginal birth. So this one also depends with who is managing you. Another question is, where are you planning to deliver? If you're having a VBAC, it's important that you deliver in a hospital that has facilities. In case of an emergency, you are immediately wheeled to the theater. Number 4 also, if you had a cesarean section because of having a cephalopelvic disproportion. This one means that your pelvis is contracted, or there was a misfit between your pelvis and the fetal head, or you have a narrow pelvis. This one outright, you cannot try a VBAC because the narrow pelvis cannot be corrected. So most of the time, all your deliveries will be having a cesarean section. But what I want to say is that VBAC or vaginal birth after cesarean section is very much possible, and there is actually like very high chance of you going into normal labor and giving birth to your baby normally. Also, there are some mothers who have had ectopic pregnancy before and they went for surgery. Also, if you know you had a previous ectopic pregnancy, you also have a high chance of having a vaginal birth after having gone through the removal of an ectopic pregnancy. Actually, there is 70% of you having a vaginal birth. So you can try a vaginal birth, but under close monitoring. At Midwife Caroline here. Follow, like, and share. Thank you.